Today, this Children's Trust of South Carolina released their 2024 legislative priorities.
Yeah, and they include lowering maternal and infant mortality and also increasing access to care. News 19's Becky Buds has the details.
This legislative agenda was shaped by input from advocates, parents, and students from across the state.
Big problems require bold solutions.
On Wednesday, the Children's Trust of South Carolina released its plan to improve infant mortality rates, mental health, and access to childcare. A 2023 report released by DHEC shows that infant mortality rates rose 12% from 2020 to 2021. Dr. Ramkumar Jayagopalan has seen firsthand how voluntary home visiting programs help reduce that number.
So they teach them parenting skills so that in the first 3 years of life, which is critical for these babies, the parents have a head start on how to handle these kids.
However, less than 10% of eligible families in the state receive these services due to a lack of funding and knowledge about them. The trust says South Carolina has the potential to help an additional 900 families by investing $250,000, with this funding being tripled through a federal grant program.
And actually has incredible outcomes, lowers crime rates, lowers hunger, improves obesity rates, all the things that we would want.
The challenges extend to child care access too. More than 15% of unemployed women can't work due to the lack of child care options in our state.
We need to update child care tax credits, increase access to child care, and make it more affordable for families to place their children in care.
In addition to these initiatives, the Children's Trust is also focusing on expanding free breakfast and lunch programs in public schools and prioritizing crisis stabilization units, which are mental health versions of emergency rooms for children and youth.
We don't want our children ending up in DJJ, in jail someplace because we don't have a place to go.
Legislation to address these issues can't be taken up until lawmakers return in January. Reporting at the State House, Becky Buds, News 19 WLTX.
Lawmakers have created a joint committee to study child care services. Their first meeting is November 30th at 11 a.m. And when it comes to national data, the statistics show the infant mortality rate in the U.S. rose 3% from 2021 to last year. It's the first year-to-year increase in 20 years. Among the observed increases, infants born preterm, male infants, as well as infants born to women between the ages of 25 and 29. Rates were up in 4 states, Georgia, Iowa, Missouri, and Texas, and down in only Nevada. And when it comes to babies in South Carolina, the latest data from 2021 shows 416 infants died during their first year of life. When it comes to the mortality rates, white babies had a rate of 5.2%. Black babies had a rate of death more than double that at 12.7%, and Hispanic babies had a rate of 5.1%. The study shows deaths included sudden infant death syndrome, accidents, and respiratory disorders.